So I'm sure there are questions or comments from the audience. I would actually be also curious to hear from you, kind of sharing a bit of crossbreeding from your experiences. So if we'll have any time, it would be interesting to hear your reflections on others' works. But who would like to start? I'm seeing at least 3 hands on this side. Here first. And please introduce yourself.
Yes, thank you very much. I'm Jonna Haapanen from Save the Children. Thanks a lot for the very, very interesting pieces of information that you shared with us. For Rachel, thanks a lot for the very promising, encouraging results in terms of the buffering effect of social protection and the safety net program in the conflict. And you definitely had a very interesting time period of doing the data collection. So I was wondering whether you had in your data differences between the safety net cash only and cash plus, between those two. You perhaps mentioned those, but I didn't get that. So whether the cash plus or safety net plus program had more positive buffering effect in terms of that population. And maybe if I can give to Richard also, thanks for the child-sensitive approach or gender-sensitive approach on the child impact. I would be interested in hearing, because it seemed to me relatively short time period when you did the baseline and the end line. So on the effect on the caregiver, let's say sensitivity or on caregiver impact on child development. So what kind of methods were used actually in the program in order to get that kind of result in that time period? So if you could describe a little bit what methods were used in the project. Thanks.
Thanks, and let's then take at least 2 more from the same side.
Hi, I'm Jessica Light from IFPRI. I also have 2 questions. For the paper in Somalia, I was wondering if you had data about actual implementation, because another simple explanation for what you found was that the program was not implemented in line with the randomization or did not target those who you sampled. And like generally null effects would be consistent with that. And then for the Mozambique paper, another explanation for what you find is that the eligible who are waitlisted are just slightly better off than those who are not eligible, and that would be consistent with program staff using their own information or local information to target those who are needier. That seems a little bit more parsimonious than some of these explanations about income suddenly going up and then down when a transfer is added. So I was wondering if you could test that hypothesis or had any data.
Thank you. Then one more over there.
Thank you very much for your presentation. For the 4 presenters,
could you introduce yourself first?
Sorry?
Could you introduce yourself first?
Okay, I'm Professor Emonye Oduchi-Peace from Nigeria.
Yes, go ahead.
Okay, thank you very much. The 4 presenters, I didn't see your recommendations. Thank you very much for presenting first. I'm concising time. I didn't see your recommendations. At least we can, based on that, to coin our own research topics. Then the second presenter, I think it was too cumbersome for us. So if there's something you can tell us summary for us to learn. Then the last one is the food security. Somebody mentioned food security during is it social pension? So I want to know, you said if they are giving payments regularly, it will increase food security. How? Thank you. I think I heard that. I think the last presenter, did he get me? I said, during your presentation, you mentioned that when they are giving their pension, it will increase food security. Is it? It decreases, yes. I said, how? Yeah. Thank you.
Thank you so much. Let's start with this, and if we are efficient, we'll have at least 1 more round. But please, who goes first? Maybe Rachel.
Okay, thank you. Jana from Save the Children. So the program that we were looking at was a Cash Plus program. It's a SPEAR program that's implemented by World Vision, Strengthening Resilience. And one of the papers that I didn't present on looks at that specifically, the plus. It pulls out the plus element from just the cash, and it finds exactly the same result in terms of protective, buffering, but not promotive. However, in that paper, we didn't also include humanitarian assistance. We were looking at a slightly different question, but the plus really did have an impact, but literally on consumption, poverty, but not on assets and anything that you might say is sort of building someone's resilience. So yes, it did. Ideally, we would have looked at the humanitarian assistance and the cash and then the cash plus, but because our numbers were restricted, we couldn't keep a balance across the treatment arms in that the paper I presented, so we just had to aggregate into the cash and cash plus.
Yes. So, to our colleague, which I did not hear your name though. Jessica. So you're asking whether we have data on implementation and whether that could help us to.
That the people you surveyed were actually treated as intended.
Okay. So, like, what do you mean that they received the money and that they were actually working? So we did ask where they were employed. We haven't explored yet a lot on that area. I think it's probably an interesting part to see. But what we know is that most of them, they were actually employed in non-agriculture related works during the lean season, which was the main objective here. But we do have data on that. I have to check what's exactly the story there, because probably it will help to give some insight over there. Thank you. And our colleague, professor from Nigeria. So if I understood correctly, you were asking about how what's the story behind the food consumption score results and how we were measuring it? Did I get it correct?
I said a recommendation.
A recommendation. Okay. I missed a little bit. I thought it was a question related to how we were measuring food consumption score. Maybe we can chat after the meeting to hear more correctly the recommendation. Thank you.
He wants to know what your recommendation would be based on the study.
Sorry. Sorry. What would be the recommendation for this study? I mean, it depends from the implementation point of view or from the evaluation, because there are some things here about the implementation point of view, which I think it's crucial, which I think is related to household identification, on the way that the country office is actually implementing the work to target households. I think this is one of the most sensitive issues on exactly finding correct ways to assess vulnerability in households, not relying so much on self-reported data that can easily be manipulated. It is true that in Somalia, households, most people have very difficult conditions, but I think one of the main problems there is that you have a community-based approach where you basically give the opportunity to the local village leaders of the clans. They basically decide who gets in the program, which I think may reduce a lot of the effectivity of the program, because most of the households that may be targeted are households that are very connected to the clan leaders, and there's very little thing to do there. So one really should ask what is the added value of intervening in such way. And the second recommendation is in terms of the methodology that in how to go into field and conduct the evaluation. I think it is crucial to go in a short period and the follow-up, especially when you want to for cash-based interventions, where most of the indicators are going to move within the program when they're getting the money. We arrived too late, almost 7 months after the program ended. So I don't think we were capturing that short-term effect of the cash transfers. So going in a timely manner to collect data, it's really important. But it creates a lot of difficulties also with implementing partners in the field, because that does not happen most of the time in a way that we can coordinate correctly with the people collecting surveys. So timely matter and household identification.
Thanks, Ivan. And before we continue, it just caught my ear when you said depending on our kind of depending who do you represent. So I think it's the greatness about UNU-WIDER is that you are able to express. I think it was in the video this morning about keeping the independence. So at least here we are amongst friends. So feel free to chip in your thoughts and lessons learned beyond what your research was done, or provided. But Richard, do you have something to add?
Yeah, no, I just wanted to respond to your question about the impacts that we observed and how they were generated. I mean, the time period between the two waves was 16 months, but as you saw, the implementation of the program was happening around the last 8 months before we did the end line. So it's quite a short period, and so we do see that it's kind of like short-term effects that we are observing. We know that the services component was also only started about 6 months before we did the end line, so it was also pretty much delayed. So the effects that we find are really and because of the way it was implemented, through this Mama Yelene, through this role model mother in the community, it could be possible that there are that the effects are still building up. Right, that this is only the first effects that we are observing. We did see increases in knowledge, but we also know that with knowledge, it's a first step of changing practices. Right, I mean that's the first step, and we did not see a very strong effect on, for example, infant and young child feeding practices. So we do see increases in knowledge, but not really increases in practices. Which would be maybe the next step that we expect. Maybe that is something that needs more time to develop for women and caregivers to be able to process that knowledge and to really act on their knowledge. So hopefully that is something that we will be able to do in a more longer term follow-up. But yeah, I mean, the first step is there. And I think in terms of recommendations, which is a really, really good question, and I think that's why we're all here, right? To learn from our studies and to see what we can take away from that. At least in our case, I think one of the interesting common threads through our presentations was also these challenges in implementation and maybe the difficulties in the context of the countries that we are all studying, which makes it very difficult to design a program and implement it according to plans. But given those difficulties, and also in my presentation, which I showed that the implementation was not really happening according to plan, it still was able to generate some positive results and very important results. In our case, for children during a very critical window of development. So if there is a choice between doing nothing and doing something, which is messy, but it can still generate some positive effects for households and for children in our case. So it does speak to the importance of integrated social protection, and I think that as we continue to try and implement these programs and learn from them, and help governments institutionalize these programs and build capacity so that they're able to implement these programs in the future, then I think that we are on a way to success.
Mm-hmm. Thanks,
Thank
Richard. And then Hannah.
Thank you. Yes, first question by Jessica. Maybe the people eligible are slightly better off than the beneficiaries. Yeah, that's possible, even though when we check statistically, they are very, very similar, and there are no like big statistical differences. But of course, we don't have a super clean baseline, right? Because this program has already been ongoing, so we did not interview them before they ever received any payment. So that is for sure, and yeah, related to what Richard just said, it's very difficult to measure very cleanly such programs, just because the implementation is messy. But that's also why it's important that we get follow-up data and follow the same beneficiaries over time to actually understand a bit better what is going on, and to perhaps also do qualitative interviews to understand this better. And then on the question on how food security can decrease when people get a pension. So there are different explanations, right? In our case, most likely it's because the benefits have not been paid for a long time. So, as mentioned, the beneficiaries did not receive any transfers for more than 8 months. So it's possible that when they receive a transfer, it's positive, and then they get a bit like dependent on the money, thinking they will receive money very soon, but not receiving it, and that is why there are negative effects. And another explanation that was also presented here in a project on Somalia is that people might be consuming different kind of food. Like, just because they receive more money does not always mean that they receive better food. Like in that case, I think they consumed more meat and eggs and less veggies. So that does not mean that the overall food security increases. Thanks.
Thank you so much. Then we'll have a chance to ask a few more questions. Depending how complex and tricky they are already been quite tough. Let's see how many we can take. There is one at least.
Yeah, thank you very much. Excellent presentations. I have a very simple question, I think, to Richard. You mentioned that there was an exit strategy associated with women's savings groups. It wasn't clear from your presentation whether that was incorporated in the analysis, or is that something you're going to be working on in the future? Thank you so much.
Thank you. And then there's one on this side.
Thank you. Amber Peterman from UNICEF. And I have a follow-on question for Richard on the women's savings groups. So we often, make the recommendation that to garner sort of buy-in for targeting women and to ease implementation, women's groups is a good platform, especially in cases like Mali, where previously the Jiggy program went to male heads of households, but yet you didn't find any impacts on women's decision-making agency. Can you unpack that a bit more for us? Were there any favorable sort of group-level dynamics you can point to, or was the savings group model just sort of, aiding implementation itself?
Many thanks. Anything else at this stage? Well, now the spotlight is on Richard, so if you'll answer these two questions and let's see how it goes.
Right, yes. No, those are really good questions. So yeah, let me start with your question, Sam, about the women's savings group and the how they were set up. So they were not set up as part of our study. They were existing at the time. Because before our study happened, there was a social safety net in Mali, which was called, as Amber said, Jiggy, because I'm unable to pronounce the full name of the program. But that happened. That was happening for 3 years, and once that kind of ended, the implementers of that program decided to set up these women's savings groups in the communities where this Jiggy program was operating as a kind of what they call an exit strategy. So they stopped with the national safety net, the transfers, but in return they set up these savings groups so that people were able to come together and start saving and start using the saving mechanisms at the community level to obtain loans and to maybe grow their income a little bit. And those savings groups and the question on the savings groups and whether and because they existed for this program, they thought this was a good way of targeting women, of using this platform to target their program, their new program. Now there has also been some criticism of that approach because obviously not every woman is in a savings group in Mali or in any other country, and what we also know from other research that it's sometimes the most vulnerable women that are not part of these savings groups because they have nothing to save, so they are not able to take advantage of these savings groups. So it's a little bit, it's easy because the platform is there and the organization is there. But on the other hand, you risk missing out on some of the more vulnerable populations in society that are not part of these savings groups. So that's a little bit tricky. Now, whether in our case we didn't find any strong impacts on the empowerment or the decision-making power of women, we know that while the money was targeted to women, to be received by women, obviously they are part of a household. And I think that even in this case, there were situations where they were trying to transfer the money to the phones of women, and not all the women own the phone that the money is going to. So it's difficult to say that despite the targeting to women's groups, that there was 100% certainty that actually the money was entering into the hands of the women, in contrast to the Jiggy program, where the money was in the hands of the male household head. So there is still a lot to do and unpack there in terms of how we can be more gender sensitive in these programs and how we can make them more, at UNICEF we like to say, gender transformative, not just addressing really the structural roots of some of the gender equality that we see in these countries. Thank you. I hope that answers the questions.
There is one at the very back.
Thank you very much, Franz Celestine, IOM. My question is for Ivan. I think you presented on Somalia. You mentioned that the approach to the program was community-based. They go to the clan elder and they identify the person or the household. Did you consider in your study the impact that aid diversion might have on the effectiveness of the program? Because if you go to a clan elder, it's very likely that minority clans would be excluded. And how did you account for this in your research?
I missed your name, sorry. Franz. Thank you for your question, Franz. It's very, yes, I guess like the easiest way to do it, which we didn't do it, is like to account for non-beneficiaries in our sample to see what's happening. But we didn't do it like they usually don't let. It's not that easy to collect data actually from households. It gets very tricky even with participant households that to have their time usually compensated to participate in the survey. And clan leaders probably also would react a little bit, like going to the households of the people that were excluded intentionally. But I do think that that's something that should be accounted for, because I think it does create an act on a local dynamic of inequality, and it may actually just generate conflicts. We lost a couple of villages during the data collection because there were some conflicts of clans that they had to stop these movements in those villages, and there were no security conditions to go there and for the implementing partners or for the people going to collect data. But yeah, just to answer your question, I would say that community-based approach is it's difficult, and sometimes is the only way that people can actually enter to make an intervention. We tried in a different cash intervention because FAO had a whole package of cash. There was cash plus livestock, cash plus agriculture, cash plus fisheries, and this one, cash for work. And all of them, they were canceled because of USA disappear, right? But we were trying, we learned a lot from cash for work, and then when we were gonna start cash plus livestock, we wanted to try a different approach, which was we were more proactive. So instead of having the country office, to do the typical community-based approach, we conducted a census of Somali villages in the regions where we were gonna potentially work, because there's very little data to actually, even at the community level, let aside at the household level. So we collected data for around 200 villages, and based on that, we provided a list of households that were actually following certain criteria that landed based on food security, on some vulnerability issues, which were related to the eligibility criteria in the project. And the first thing that we stumble upon is the eligibility criteria in the projects are usually very poorly designed. So it's hard to have a good sample based on that. And then the country office struggles a lot, actually. So we help them by giving them the data and saying hey, out of these 200 villages, these are the people that can be targeted according to your own criteria. And then they went to the village to kind of follow a little bit the advice, and they had a lot of problems following that approach, because they felt that we were strangers coming to their community with a list. They were who are these people? Yes, they may be some of them in the village, but because they were nomadic, some of them, they were really upset that they came from a different village. These people does not live here, and it created a lot of problems actually. They had to go to higher levels of management to solve these issues. So sometimes our colleagues here say it's messy, but it's the only way. But one should ask, is it ethical also to follow that one? I don't know. Those are tough questions.
Indeed. I mean, it's been an excellent session, and many thanks to your presentations. Like said in the beginning, considering the turbulent times we are in, your topics are more relevant than ever. It would have been an honor to continue with another 1.5 hours, but we'll need to do that in the corridors, and we have to respect the time, which was my responsibility. And the time is 3:30. So let's give an applause once more for the presentations.